We are shifting how we measure the pandemic this week. And that's because 2/3 of the COVID-positive patients in Colorado's hospitals currently are there for something else other than COVID and just happen to have COVID. That is a big and recent shift due to the less serious, more easily transmissible Omicron variant. That news this week and our discussion about how we are going to de-emphasize hospitalization numbers as a result has given some fuel to pandemic deniers who claim without evidence that most COVID patients throughout the pandemic have not really been sick with COVID, they've been sick with something else. So this argument, try and follow me now, is that healthcare workers are not actually heroes, but they're really bloodthirsty scam artists who just want to rack up COVID diagnoses and deaths to make profit for their hospitals. One of the logical issues with that bat guano theory is why hospitals would suddenly stop that money-making scheme now, right as diagnosed COVID cases go through the roof.
So we have seen this shift happen really over just the last couple of weeks. So we do really believe that this is associated with Omicron. It's really been just since mid-December when we really started seeing Omicron take off that we started to see this proportion change.
With hospitalization numbers less useful thanks to Omicron, we are now shifting our daily checks to ICU bed capacity, hoping to give you a better gauge on hospital strain. Right now, there are 113 open ICU beds across the state, so 92% of them are occupied. Important to have context on that numbers because hospitals are not built to sit empty, so capacity is not going to sit down near zero. We wanted to know what hospital bed use looked like pre-pandemic. For some context, Hospital Association tells us that pre-pandemic average for statewide hospital bed occupancy was 68% in 2019. Rural counties, it was 40%. Now there we're talking about all beds, not just ICU beds. The Colorado Hospital Association tells us ICU bed use typically runs a bit higher than other beds because there are fewer of them.